Welcome to Steady Balance on Spotify, your space to understand the science behind balance and vertigo.
Good day, I am Dr. Anand Raju, ENT surgeon, talking from Coimbatore from Anand ENT Hospital. So today we are going to talk about vertigo, understanding vertigo, why it happens and what it means. Have you ever turned in bed, looked up suddenly, or stood up and felt like the whole room was spinning? If yes, you are not alone. That spinning feeling is often called vertigo, and for many people, it can feel confusing, frightening, and deeply unsettling. Welcome to Steady Balance. This is episode number 1. We are going to talk about vertigo. Today, let us understand vertigo in simple words, what it is and why it happens, and what your body may be trying to tell you. First, one important point is vertigo is not a disease by itself. It is a symptom. In simple terms, it is a false feeling that you or the world around you is moving even when everything is actually still. Is sensation of floating or maybe flying. Some people describe it as spinning, others describe it as swaying, tilting, or feeling pulled to one side. It may also come with nausea, sweating, unsteadiness, or sudden fear because your sense of balance no longer feels normal. So, how does the body normally keep us balanced? So, let's discuss about the physiology of balance. Your balance depends on three systems working together. Your inner ear senses movement and position. Your eyes tells your brain what is happening around you, and your muscles and joints tell your brain where your body is in the space. All three systems joins together maintain your balance. Your brain blends all of these signals together every second so you can stand, walk, turn and move safely. When the signal match your feel steadily, when they do not match, the brain get confused and that confusion can lead to vertigo. In many people, the problem starts in the inner ear. The inner ear is the main culprit. Inside the inner ear are tiny balance organ filled with fluid and delicate sensory cells. This semicircular canal help detect turning movements of the head. The atricle and saccule help detect the straight line movement and gravity. So two organs actually, the semicircular canal and atricle and saccule help detect the balance movement in the body. When the system sends wrong message or when the message does not match what your eyes and body are sensing, the brain may wrongly think the movement is happening. That false message creates the spinning feeling of the vertigo. So, mismatch can also cause nausea, vomiting, unsteadiness, and abnormal eye movements. So, if vertigo has ever made you feel frightened or helpless, please remember this. It is a real physical symptom. It is not imagined and it should not be dismissed. One of the most common cause of vertigo is a benign paroxysmal positional vertigo. Short term we used to call BPPV. The name sounds complicated, but the idea is simple. Tiny crystals in the inner ear can move out of place. When that happens, rolling over in bed, bending down, or looking up can trigger sudden spinning. The good news is that this type of vertigo is common and often treatable, completely curable. Another cause of vertigo is vestibular neuritis. This happens when the balance nerve becomes inflamed, often called as viral neuritis because of the viral infection. The result can be sudden severe vertigo, nausea, vomiting, and trouble walking steadily. The third common cause is Meniere's disease. In this condition, changes in the fluid balance in the inner ear can interfere with the normal hearing and balance signals. Along with vertigo, a person may also notice ringing in the ear, hearing loss, or feeling of fullness or pressure in one ear. All these associated symptoms may cause vertigo. Along with vertigo, may stimulate your body or may cause nausea, vomiting, or sweating, or sensation of fall. It is also important to know that not all vertigo come from ear. Sometimes it can be related to the brain, for example, migraine, multiple sclerosis, or in some cases of stroke. That is why vertigo should not be ignored. If it comes with warning signs like double vision, slurred speech, facial weakness, numbness, trouble walking, or sudden severe headache. In those situations, urgent medical attention is very important. The good news is that many causes of vertigo can be treated. Some people improve with a simple head positioning maneuver, especially in benign paroxysmal positional vertigo. Others may need medications, balance exercise, or treatment for the underlying causes. So, the key message what I am going to tell is please remember this: vertigo happens when the body balance signal become mixed up and the brain sends movement that is not really there. If you or someone you know is having repeated spinning episodes, falls, hearing changes, or severe symptom, please do not ignore it. With the right evaluation, the cause can be understood and treatment can help bring confidence and balance back. Live healthy and without vertigo. Thank you so much.
A public awareness initiative by Dr. Reddy's. This communication does not substitute advice of a medical practitioner. Please consult your doctor for any medical advice.